Three, two. All right, it's time to talk with our featured guest, Dr. Nkemakonam Egolum. Dr. E, how's it going?
I'm doing great. How are you, Michael?
I'm doing pretty good, man. Thanks for asking. I've seen you a lot on LinkedIn recently, and I'm like, who's this guy who's doing amazing in Maryland, which I've never been to Maryland, but what tell us a little bit about your past, your present. How'd you get to where you are today?
Great. I'm happy to have a presence on LinkedIn, which was, by design. My name
Mhm.
is, Nkemakonam, as you mentioned. So I'm actually Nigerian. I was born in Nigeria. My dad left Nigeria when I was about 3 years old. We moved to Jamaica and we lived there for most of my early childhood years. Then we finally came to the States. And my initial goal for coming to the States was obviously seeking better opportunity, which is, what most foreigners do when they come to the United States. It's the land of opportunity. So that's what my dad wanted for us. So he always had a vision that one day we should come to the United States to pursue higher education. So I kind of came here with my eldest brother. He's a cardiologist. He does
Hmm.
practice in Atlanta, Georgia. Followed him to Howard University, where I did my undergraduate studies. Then I stayed for dental school after falling in love with Washington, D.C. I didn't want to leave the area. And after dental school, I then proceeded to complete 4 additional years of oral surgery training at Howard University Hospital before opening my practice here in Maryland.
Nice. Okay, man, that's good. So rewind a little bit. Do you remember any of your time in Nigeria?
Honestly, because I was so young, most the most vivid memory that I have is just like, playing as a kid, maybe in the market with, a lot of people around, shopping, selling,
Yeah.
and like begging my mom to buy me candy and she, her buying me candy. And
Yeah.
that's the only vivid memory I have. Everything else is more of like a blur. Most of
Okay.
my memories are from Jamaica.
Okay. So then fast forward to Jamaica. You were when did you leave Jamaica? Like what age would you say?
I was 17 years old when I left.
Oh man. Okay. So you were in there for a minute. Like,
Yeah.
okay. What did you, I guess, enjoy about Jamaica where you're like, okay, you know what? Was it in Jamaica where you're like, I'm going to be in dentistry or in dental school or something? Or no, not yet.
Funny enough, so my most people in my family are in healthcare, just like a lot of foreigners are. So you're always taught that if you want to have a job that's going to have staying power, a career that you can take with you anywhere in the world, that healthcare is the field to look into, the professions pretty much. So my dad was a pharmacist, so he always emphasized sciences, and so most people in my family did the same thing. We kind of followed along the same path of sciences. My initial goal was actually to become a plastic surgeon. So that was my
Mm.
initial draw, was a love for surgery and kind of cosmetics and art. So I wanted to kind of blend both into one. But after coming to the United States and learning about the medical system and then learning about dentistry, which we don't have a lot of exposure to in Jamaica,
Hmm.
it kind of pulled me more towards dentistry once I got exposed to oral surgery in the hospital setting, pretty much. So my first exposure to oral surgery was with an oral surgeon in a hospital setting, and I had never heard about oral surgery, never heard about much about the dental specialties until I kind of shadowed in the hospital for a few years. Then I kind of fell in love with the procedures that oral surgeons did, essentially.
Okay, okay. You mentioned you learned about the medical system in the States. What do you mean by that? Like, what did you learn?
So there's a lot of good things in the sense that there's a lot of higher education here, a lot of great research, and a lot of pioneers in the medical space here in the United States. However, I think with insurance kind of
Mm.
controlling the way medicine is delivered and the direction that medical practice is going, it's almost as if the doctors are held captive by insurance companies to do certain procedures that they may or may not agree with, in certain instances. For instance, if I'm an emergency room doctor and there's a patient that has come in 4, 5, 6 times in that week, and I say, hey, what are you here again for? He says, hey, I'm here for the same thing. I have, belly ache. And if I know this person is just like what we call a malingerer, just coming in just to kind of get free food, get free medications, and then, go back out in the street and come back again, legally, and, by insurance standards, you have to do the same things. You have to run the same tests. You have to check the patient for certain conditions, and you may even need to prescribe medications and to try to avoid the person readmitting or coming back to the hospital, even though you as a doctor may know, okay, I know this person, I've seen them many times, and it's typically wrong with this person, so I'm gonna manage it this way. But based on insurance, you have to do certain things legally and insurance wise. So with
Mm-hmm.
dentistry, it is slowly moving in the same direction where managed care and insurances are kind of starting to dictate what kind of care patients receive. However, most patients in dentistry, when they see you, it's not life or death for the most part. It's mostly elective. So you do have the choice of saying, hey, this is what I recommend, even though your insurance doesn't agree with it or insurance may not cover it. This is the recommended treatment. And the person can leave and choose not to do the treatment and may, go to find a different doctor that may agree to do the treatment. But I'm not legally liable for anything because I didn't render treatment to the patient. Whereas in medicine, in some situations, you may be legally liable.
Yeah, I never knew that. Do people really like, do a lot of homeless people do that? Like they linger, they're like, hey, I'm gonna come back, and there's nothing really wrong with them.
Yeah, I worked in the emergency room for 2 years in two different hospital emergency rooms. And I saw firsthand, pretty much just the abuse and the waste in the medical system. You'd have the repeat offenders, same person will come in, 2 days in a row, same issue. You have to run the same test. You do an X-ray, an ultrasound. You give them, a narcotic medication because they're supposedly in so much pain, and then you discharge them, and then tomorrow they're back again, and
Mm.
you have to treat them. You cannot turn them away. Versus in dentistry, if I have a patient that's a difficult patient, problematic patient that I've already seen, and I don't believe there's anything additional that needs to be done, I can simply say, I don't believe you need any further treatment, and this is my recommendation, and that's the end of it. But in medicine, it's not the same. You're held to certain standards, and legally, you're responsible for making sure certain procedures or protocols are followed.
Yeah. Has that happened so far in your practice? Like where somebody's come in and you're like, oh, you just want the drug.
Yeah, it happened not frequently in the location that I'm in currently, but in the previous location that I was in, it's an area called the Greenbelt in Maryland.
Mhm.
The office that I worked in, we had a large population of maybe people from lower socioeconomic backgrounds. So a lot of times, unfortunately, some of them would come in and try to pretend to have a toothache just so they can have stronger medications. And usually they'll come in asking for it by name. They'll say starts with letter P or something,
Mhm.
they'll say oxy or something like that. So that's usually a telltale sign, especially when it's just a cavity or something small that can simply be fixed by seeing a dentist. But they're moving from office to office, and you can see the history because you'll see that they've already been to two different offices and they've already been prescribed prescriptions for maybe narcotics. Then now that you're in your office and they still haven't gotten the recommended treatment, which could be as simple as filling a cavity or maybe
Mm.
food extraction. So you know that that person is pretty much seeking medication. But in my current location in Bowie, I don't really have too many of those patients, thank God. So.
Yeah. No, that's good. So then how do you handle that, Dr. E? Like, especially if they're like, they get angry sometimes and they're like, no, give it to me right now. Like, I'm gonna leave you a bad review. And you're a practice owner, so you're kind of like, man, I don't want a bad review, all these things. How do you handle it?
So for me, what I try to do is I focus on evidence-based practice or science-based. So if I look at the patient and I see that they have an ailment, let's say a broken tooth, maybe an exposed nerve or something, then I would recommend removal of the tooth right away if it's a tooth that's not salvageable, let's say. And if the person refuses the treatment but just demands the medication, then what I typically would do is I'll prescribe a combination of acetaminophen and ibuprofen, because the science has shown that those two in combination and alternated together is actually more effective than an opioid or narcotic. So that's what I usually explain to the patient. And if they don't agree with it, that's my stance. I don't bend the rules, because someone's
Mm-hmm.
angry or pushing me to do something that's against my training, pretty much.
Yeah. No, that's good. That's really, really good. Okay. So then fast forward a little bit more, and you went to Howard University and you fell in love with Washington, D.C. Why?
So Washington D.C. is a multicultural, multi ethnicity, and just kind of a worldly city. So everyone from any walk of life you can imagine would be coming to D.C. for one reason or another, whether they're studying at in a university, or they're visiting just to tour the historic sites, the museums, the White House, those kind of things. So you get to rub shoulders with a lot of people from different walks of life. So it's almost like a melting pot. And
Mm.
I felt very comfortable here because there are a lot of people that, come from Africa, from the Caribbean, from, all different countries, India. So I've met a lot of different people here, and most people here are very highly educated. So I think that's the environment for me that I thrive best in, being around a lot of academics and people that are well read and well traveled. So DC is like the perfect place if you want to have that type of environment.
Nice, man. Okay. And then you took 4 more years, right? Into oral surgery. Why'd you go that route?
So after meeting the oral surgeon, well, I met her while I was working in the hospital in the emergency room by chance, and she said, "Oh, I'm an oral and maxillofacial surgeon." So I said, and I go, "What's that?" And she said, "Just come, come see what we do." So I followed her. We went to I went to rounds with
Mhm.
residents in the hospital, kind of saw them treating patients that had jaw fractures, maybe doing a post-operative visit on a patient that they had already treated the day prior, or someone that has like a large infection that they're planning to take to the operating room to manage the infection. And I was just amazed because one, it's very surgical, as the name implies, oral surgery. So I loved the surgical aspect of it, and because I started kind of growing a resentment for the medical or the healthcare system, I said,
Mhm.
well, let me look towards dentistry, since I found a specialty that aligns with my interests, which is surgery, cosmetics, and art. So after shadowing for a couple of years with that oral surgeon, that's when I decided this is going to be the specialty for me. And before I even applied to dental school, I knew I wanted to do oral surgery. I didn't have any other exposure to any other specialties in dentistry, and I just loved the surgical aspect of oral surgery. I did. There's no other specialty in dentistry that has that much surgical involvement at all. So it was an easy choice for me after that chance exposure in oral
Yeah.
surgery.
Nice. Okay. So then right now in your practice, is that what you mainly focus on? Surgery or what is it?
Exactly. So I'm limited to oral and maxillofacial surgery. So I do anything from teeth extractions, including like wisdom teeth. I do dental implant surgeries. I do bone grafting or ridge bone augmentation surgeries. I used to do some jaw surgery or orthodontic surgery, but in my current practice, it's been difficult to find those cases because
Mhm.
most of the cases are typically referred to the hospital setting or to maybe a larger, more established oral surgeons in the area. So my primary focus is the bread and butter oral surgery, which is typically teeth extractions, IV sedation, dental implant placement, which is what I do mostly. And dental implant surgery is my special focus or my special love in oral surgery. Even though I love all of oral surgery, but dental implant surgery is something that I've taken I've fund or loving for, and it kind of focused a lot of my energies and attention in trying to improve and add to my repertoire of knowledge as it pertains to dental implants.
Gotcha. So you don't do any like preventative work as far as like, oh, I got some cavities. Can you fix that or
Yeah,
no?
no, like since I graduated dental school in 2013, since then I haven't done like a dental filling or restoration or anything
Mhm.
like any dental work since then. All I've done is pretty much the oral surgery procedures. So even if I wanted to, I would be the worst person to do a filling or a crown or a bridge on someone, because I don't honestly don't even remember the basics of doing those procedures, because I haven't done them in all 10 years now, pretty much.
Yeah, yeah, 10 years. Wow. Okay, so 2013, you graduated. When did you open up your practice?
So I opened up in pretty much, I started opening in 2017, but I officially started seeing patients late 2018 to 29, early 2019, because I
Well,
worked group practice first before opening up.
okay. So you had the location you were gonna open up, but it was just there. Were you still paying rent throughout 2017, 2018 until you opened up, or how did that
No,
work?
no, so when you're opening a practice, it's a very long, laborious process. So there's a lot of things that you have to do. One, you have to create an entity. So it could be LLC, S corporation, whichever you choose. And then once you have that, you need a tax ID number so you can be a legal company that can pay taxes. So that may take about a week, let's say, or 2 weeks to get all that finalized. Once all that's done, then now you're beginning to search for an actual office space. You do your demographic studies to make sure the area can support your surgeries or your procedures. Then usually you're working with a broker that's going to take you on tours, kind of like looking at a home to purchase, but in this case, you're looking at an office to rent. So you're looking at multiple spaces, making sure you're not violating like non-compete agreements that you may have with your current employer. Once you find the location, then you have to start the letter of intent. So you give a letter to the landlord explaining what your plan is for the space. If they agree, then they'll offer you the terms that's available for renting or buying the space if that's what you decide to do. In my case, I decided to rent the space.
Mhm.
After that, you start a negotiation process. So you negotiate the terms of renting the space with the landlord or the broker or brokerage company that's renting you the space. That could be weeks, months, because you have to hire an attorney to review documents. You go back and forth. Maybe you redline certain items, add certain items in. They renegotiate, and eventually, once they agree to the terms, then you sign the lease, and then they give you like a future commencement date. So you're not actually paying any rent until you actually finish building your space and then open your doors. So the build out process, that's the part that takes the longest, because you have to get permitting done, and that could
Mhm.
be months, 6 months. You just don't know how long, depending on what state you're in. So once your permitting is done, then you can actually start the building process, and you start the building. You help with the design of the space, how you want the space to flow, how many operators you want, where you want them located, the type of equipment that you need, all these things. And it's so much that goes into it. By the time you finish your office, it's probably going to be a year from the start to finish before you actually open your doors. So I started early enough, knowing that I wanted to um, had my own private practice. So I kind of started after I took a job with a group practice. I started looking at office space just in case I didn't like working in the group practice, which I didn't. So then I ended up, starting the process from looking and, then building out eventually. That's why it took so long.
Hmm. You didn't like working at the group practice, you said.
No, it wasn't for me, honestly. Some people might like it. The office I worked for was nine offices, 10 doctors, and it's pretty much corporate in my opinion. So it's a lot of moving parts. It's very chaotic. So as you would imagine, a big operation, can be very chaotic. It's extremely busy. A lot of
Mhm.
patients all over. We had probably over 100 different doctors that were referring patients to the offices that I was working in, and when you start off in a group practice, because you're the new guy, so to speak, you have to pay your dues, kind of like anything in life. You pay your dues. So you're maybe seeing the less productive cases that the older doctors no longer are interested in treating. So you're trying to make production goals that they set for you, but it's almost impossible because you're working very low production procedures all the time. And then let's say you get a large case that's high producing, the senior doctor may choose to take that case and do the case themselves, in which case it doesn't count as a production goal for you. So a lot of these larger groups, they're production driven. Even though it's you're providing a service to patients, it's still a business, and you have to meet production goals in order for you to survive as a business. So for me, it just wasn't the kind of environment I wanted. I wanted an environment where I can actually control the patient flow, the experience of the patient when they come in. I want to be able to sit down and speak to the patient so they can understand clearly what the procedure is going to entail and decide, whether or not they want to move forward or not. In a larger practice that's extremely busy, you're usually running from room to room. You don't have as much time to spend with each patient. And I find that makes for a poor patient experience in the long run and possibly higher complication rates because you're rushing.
Mhm.
And no matter how good you are at anything, if you're rushing, you're gonna be more careless than if you're taking your time and paying more attention. So that for me, that was the reason. But some people love group practice. They like the idea of bouncing ideas off other doctors. For me, I'm very self-centered, self-driven, self-motivated. So for me, it's easy for me to just read something or take a course and practice and get better on my own. I don't feel the need to always bounce ideas off someone else, but occasionally I do. But
Mhm.
it's close friends that are in the profession. We talk, discuss cases as needed.
Yeah, I like that. No matter who you are, if you're rushing, you'll be more careless. That's true, man. Yeah.
Sure. Yeah.
Don't they say like slow is smooth and smooth is fast? So you got to be like real, particulate.
Exactly. Especially when you're doing, surgery and you're working close to a lot of vital structures, nerves, you're working close to blood vessels, arteries, veins, and you could easily maim someone, and it could be a permanent injury that's not repairable. So you always want to slow down and you want to think and be cautious and treat the person as you would like to be treated or you'd like your family member to be treated. So in a larger group practice, not saying that they're not doing great work, it's just it's harder for you to do excellent work when you're under stress and you're pressured. You're seeing 30, 40 patients in a day. That's superhuman level concentration and focus. And most people after, let's say, 12 hours, you're really tired. You know what I mean? So it's very difficult to run a business like that and do it every single day, 5 to 6 days a week, and still give your 100% best to everyone.
Yeah. How long did you end up staying there?
I stayed there for almost 2 years.
Oh man. Yeah.
Yeah. So I opened my office in the latter part of my tenure with them, and I started seeing patients in my own practice and kind of going between my office and their office until it became disadvantageous for me to continue. So
Hmm.
I know, well, unfortunately, I'll be moving on, at the end of a certain period of time, and they were fine with it, and we split amicably, and I agreed to the non compete that we signed, and the 4.5 years later, I have my own thriving practice, so it was a good decision for me.
Yeah. That's good, man. All right. So can we jump into your business now, your practice?
Sure.
Like get a little bit in the details. All right. So when it came to your loan process for the practice, which bank did you go with?
Initially, I started off with Bank of America, but My issue is a little more difficult because I initially came here as a foreigner, so I'm an international student, right?
Mm.
So to get a loan to start a business is almost impossible if you're an international student. So I was on a green card after I finished my residency, and I started with Bank of America, and I almost got to the end to finalize the loan until they realized that my green card was a conditional green card, so it was going to expire after about 2 years if I didn't have a job that was going to sponsor the green card. So then they decided that wasn't a good idea for them to finish the loan, so they pretty much terminated the loan with me at that point. So then
Mm.
I found a different bank, which is Wells Fargo, and they were not as strict on that rule. So they were okay with me just the fact that I had, legal green card status. So I went with them. The downside with going with them is their loans are interesting loans because they usually force you to sign over like your life insurance policy
Mm.
to and obviously they're scared that if something happens to you, they're not going to be able to recoup their money. So I understand that, but I think if you're opening a business, you should be able to take a loan under a business that's a legally formed entity. I don't think they should tie the business to you personally, but unfortunately, in our industry, that's how it is. So they tie the loan to the doctor because you are the business essentially.
Mhm.
So, and they also had something called negative amortization, which means when you're paying down on the loan, you're not really paying a lot of interest. Most of most of your payment goes towards principal, but not much towards the interest. So eventually, the interest just keeps accruing and accruing and accruing. It gets out of control. So I
Mhm.
eventually, refinanced out of that loan. But in the beginning, just needing a loan, going with whatever bank I could get, I initially went with Wells Fargo.
Gotcha. Okay. How much was the build out, or how much was the loan in total?
So my loan was approximately about 320,000. So on the lower end.
Okay. And
Yeah, and that's
then,
my fine. Yeah, I try to be more economical about my build out.
yeah, no, what was the interest on that or terms?
Interest with Wells Fargo was 4.99%.
Okay. Okay. So it's not
So
like,
and back in 2000 17 2018. So this was like average what everyone was getting for 4 to 5%, 6% in some places.
mhm, gotcha. Okay. And then fast forward a little bit, your build out, or how did you find your location?
So I had a broker that I work with, and we were kind of pigeonholed to certain areas because of my non-compete. And
Mm.
again, I work with a large group, so they have a lot of offices. So
Oh, yeah.
you have a non-compete from each location. So not knowing this going in, I signed, the contract like an idiot. So after I finished, I had only two places that I could feasibly work because I lived in Washington D.C. So I could either open an office in D.C. or I would have to open here in Bowie, Maryland, to still have a decent commute from D.C. to Maryland and be able to not have a horrendous experience driving back and forth to work.
Mhm.
So I was kind of forced to look in this area for the most part, mainly because of my non-compete and then my proximity to my home, which we had already purchased. And there's no point of selling the home only after a year, only just because I want to open an office, somewhere else. So after finding this location, we kind of did the research, did the demographic studies, and the mean income for most families was above 100,000. So that told me that okay, they could potentially support oral surgery services. And I looked at the competition around as well, and it was about 3 to 4 other oral surgeons, but they were a little older. So I knew eventually they were going to retire. So it's kind of advantageous for me to come in as the new doctor, give it 4 or 5 years, then maybe the other guys will start retiring, and then now you become the more established name, in the area, and that's the main reason I picked the location.
Okay, nice, man. And so how much was like the build out process? How long did it take? Where was the delays, constructions, and things like that?
So for us, from once we actually started to build out, it was about 4 to 6 months actually, which was I think on the faster end. And it probably costs probably around, let's say, 200,000 for the actual build out,
Mhm.
and that's on the low end as well. I strategically looked for a company that wasn't the most expensive, you know what I mean, and we try to make use of the existing space as much as possible. We didn't do a complete overhaul. We used existing rooms. We moved some walls around, expanded some areas, but that's pretty much it. So from start to finish, once permitting was done, it probably about 4 to 6 months to completion. So our story wasn't like the typical. I've heard a lot of nightmares, and 1 year, 2 years, you're still struggling to open an office. But we pretty much, my wife and I, we stayed on top of permitting, which is what slows down your build out. So we
Mhm.
will call the department that handled the permitting in Maryland, and we kept hounding them day after day after day. And we went as high up as like the manager of different departments to make sure that things were getting done, and that's what helped ultimately expedite the build up process for us and the permitting.
What were you saying? I guess to like the permitting offices. Like I know like for example, like you can keep hounding them, but like do you just say like, is it ready? Is it ready? What do you say?
So what we did was, what my wife and I did, we told them, you guys are affecting our livelihood. Essentially,
Mm.
we need to open our office, because if we're not open, we can't generate income and we can't make any money. So you guys are affecting our livelihood. We've been at this process for, let's say, 2 months. This person that we've been speaking with has been kind of dragging their feet, and not much has been done. So we want to get someone that can actually make the decision and help move us along. And we all just kind of harp on, this is our livelihood. Without this practice open, we cannot make a living. And I just went to school. I have student loan debt. I have all this. I have a bank loan that I have to pay, and I have a rent that's going to be due at this point.
Mhm.
So that kind of put pressure on them, and eventually the manager stepped in and just kind of helped push the process along further, because otherwise you're just a number on a piece of paper, and you're at the mercy of uh, a front desk clerk or someone who may
Mhm.
not care as much about the actual bigger picture. To them, it's just another um, permit that needs to be approved, and they may put you to the back. Forget about it. They go on vacation, and then they're the only ones that can do certain things. So you have to wait for them to come back from vacation, and then then they pick it up again, and then one you're number 100 out of 200 people. So you're just lost in the shuffle. So it's good to call and advocate for yourself, and stress to them how important it is that you get this permitting done, how quickly you need to get your office open, and all the mitigating factors, such as I have student loans, I have bank loan, I have rent due, and that usually kind of helps.
Yeah. No, that's real. Like you're real. You know what I mean? Like you were honest and real about it. Like, hey man, look, like there ain't no shame. You know what I mean? I gotta get this thing done because this is my life.
Yeah, exactly.
And they
Exactly.
speed it up. Yeah, that's good. I like that. So then
Yeah.
let me ask you, how do you market and advertise your practice?
So as a specialist, it's a little different for us.
Mhm.
Our target audience is general dentists, pediatric dentists, orthodontists, endodontists. So any dentist that would require more oral surgical procedures that they may not choose to do or may not do in their office. So when I'm initially marketing, I go out, I have lunch with different doctors. I, introduce myself and my practice and tell them, what sets my office apart from the other oral surgeons, which in the beginning, the main thing is being able to get patients in the door faster, because you're not as booked out far into the future as most of the established oral surgery practices in the area. So
Mhm.
that's what we went in with, and discussed our my surgical experience and expertise. And as long as you're a nice person and you have your degree, you graduated, and you can pretty much answer their basic concerns, like, can you get my patient in early? Do you take certain insurances? Usually, most doctors will try to help you out by referring patients to at least help get your practice started, because they understand they've been in new practice before. So they'll send you a couple patients. Now, keeping those referral bases and line of communication is the difficult part, because after 2 3 years, you may not see that office anymore. You may never see the doctor again or the front office anymore. So you may not get as much referrals as you were getting in the beginning. So the balancing act is to be visible to each office, but not be annoying to the point where they just say, "Listen, just stop bothering us."
Yeah.
So yeah, so we had a marketing person initially that would go out and just introduce, themselves, and we'll bring gifts and buy lunch for the office or breakfast every now and then. But as we got older and then more established, we didn't have that person anymore. So we kind of just did good work and then let the good word of mouth spread back to the practices, and that helped solidify our name and our practice in the community. But
Gotcha.
yeah, in the more current time, the social media has become, pretty much the number one go-to for most businesses, especially for doctors. We're late to the game, actually. So I recently, realized that if you don't have a social presence, you're actually doing yourself a disservice, because a lot of the public, they have no clue what an oral and maxillofacial surgeon is. What do we do? They just see a dentist and they think that's all they need. So for us, we depend on the dentist, that they're seeing, the general dentist, the pediatric dentist, orthodontist, to say, hey, you need something more surgical. Let me send you to an oral surgeon. So, but if the public were educated enough about our profession, they could seek us out, on their own. They could say, hey, I have wisdom teeth problems. I'm going to need an oral surgeon. Let me go ahead and find one. But if we don't do enough to put ourselves out there, and social media is one of the biggest platforms to do it, then we're going to be always the last on the patient's mind. The first is, let me see my general dentist.
Yeah.
Yeah.
No, that's true. When you at the beginning had the guy going out or the person going out, right? Marketing. Would you say that was a great, like, was it good? Did they bring a lot of people in, traction? What was the approach? How much did you pay them? Things like that.
Yep. So for the marketing person, we were on a commission basis. So
Mhm.
they were getting paid, like, let's say, I believe it was like $20 per patient that actually walks in the door.
Mhm.
Uh, and initially, because you really don't know if that person is going to be effective or not, so they went out and they did generate some, maybe one or two referrals. But I had also been meeting with other doctors and having lunch with them, and going by their offices in conjunction with the marketing person going out to different locations.
Mhm.
So I did see an improvement in some offices referring, but it wasn't very significant. So I realized that most of the offices, they prefer to meet the doctor in person, and it's just a lot easier for some reason. They just feel more comfortable when they meet the doctor that they're going to be referred to. So I stopped using the marketing person for that reason, because I figured, I might as well just set up lunches, meet them myself, meet the office staff, and so they can see your personality, see who you are, and make sure they like you before they start referring. And that works out better, and that's what really helped generate more referrals.
Mhm. Did the
Mm-hmm.
person ever like set up lunch and learns for you, or they just their only thing was like you just got to bring in new patients?
Yeah, so they did help with setting up our open house.
Mhm.
So that was very big. So they helped kind of go out and advertise and pass out the flyers, and invite the different offices to come by, take a look at our office, and meet me in person for those that I didn't get a chance to meet. So that did help a lot. As far as CE, that person that I hired initially was more of a salesperson, so they didn't have a medical or healthcare background, so
Mhm.
they didn't understand those different aspects. So their goal was mainly just kind of selling, hey, this is the office, this is what we offer, here's where we are.
Mhm.
But in the future, the idea would be to get someone who's actually more adept in the healthcare field and understands the importance of setting up continuing education for different doctors and planning different events to kind of maintain that line of communication. So that's my next plan would be to hire either an office manager that's going to help to do it or a specific marketing person because that's very important for every doctor to have continuing education, and that's what most of the larger groups are doing. They do continuing education every week, and that keeps their office very busy.
So you plan to host CE in your like your facility, your practice?
Yes, because I have a
Ah.
that in future thinking when I was building the office, I have a room designed specifically for CE, and the goal is to eventually start having CE on mostly probably starting off with dental implants because there's a lot of anybody can place a dental implant, but it's a lot of different things and nuances that comes with being an implant specialist or implantologist. So I've spent and invested a lot of time in learning all that I need to learn in the dental implant space and also all the technology that's available. So I think that's something good to kind of share with a lot of the referring doctors.
Okay, that's interesting. That's going to be good. When do you plan to eventually start doing that?
Most likely in the coming months, actively interviewed for either an office manager or a marketing coordinator. So that's the difficult part. It's finding that key person
Yeah.
that's going to help facilitate all these things. Because I can do it myself, but it's always so much you can do as a doctor. Doing the procedures, running the business, and then trying to also market on social media. Then now trying to go out and host CE. It's just a lot. So you need someone to help facilitate certain things.
Hmm. Yeah, no, definitely to coordinate it all and everything. So then, real quick, rewind a little bit. When you go to these practices and you decide to talk to them, right? And you said, I talk to them, let them know what sets my office apart from others. How do you approach these practices? And then what specifically do you say when you're doing the lunch and learn? And then also when you're actually like wanting to meet the doctor?
So typically, what I would do is I would have my receptionist contact an office that I may be interested in meeting with and set up a request to set up a lunch date. And if they agree, then we'll set up a date to meet, and then I'll go by the office. And typically, I'll bring lunch and some marketing material, and I'll sit down with all the doctors if it's multiple doctors or if it's just one doctor. I sit with that one doctor, just introduce myself initially, talk about backgrounds, where I studied and stuff like that, and then introduce the office, that we're a new office in the area, and the advantages we're modern, beautiful office, and we can get your patients in quickly, and then also you try to feel out the dentists or the doctors that you're speaking with to see what kind of services they perform in their office, because a lot of doctors perform a lot of oral surgery as well, so they may not necessarily need you for specifically oral surgery, but they may need you for IV sedation. Maybe they don't do IV sedation, so you
Mhm.
just ask them, what do you do a lot of here in your office? What kind of procedures do you typically refer out? And then see if there's something that you can provide to help them, make their practice more efficient, essentially.
Yeah. Okay, cool. That's like what, roughly 45 minutes, 30 minutes, an hour?
Usually 30 minutes to an hour. Yep.
Okay.
Yeah.
So it's
And
just like,
sometimes I just go out to dinner with, one or two doctors and just, have a drink, have dinner, and then you just kind of casually talk. And, just from having good conversation that flows naturally, they may like you as a person. And even without you trying to market or sell or anything to them, they'll just start naturally sending patients to you.
Dr. E, what's more effective? The dinner and drinks where you're like, hey, what's up? Or is it the lunch and learn with the team? If you had to pick one.
I think the casual, like the dinner or just a lunch out with the doctors is more personal, and usually they get to know you on a more personal level.
Mm.
And that actually, I think, is more effective because in the office setting, a lot of people come by and do the same thing. They do their lunch and learns, and so at the general dentist office or orthodontist or pediatric dentist, they probably see maybe 10 people come in their office per month and do a lunch and learn and give them food, talk about how great they are and all this stuff. So they're probably used to that model. So I think if you have a personal relationship with the doctors and the staff, that goes a longer way than just meeting them and having lunch and talking for 30 minutes, 40 minutes and leaving. So that's
Yeah.
what I would prefer to sit, have a more intimate setting that we can get to know each other, make sure we're comfortable, we like each other. That's ultimately why they're referring, is because they like you, not really because you're any better than any other oral surgeon, because they don't know until you actually start treating their patients.
Yeah. And that's tough, man. I feel like, how do you initially do that where you're just like, hey, like for example, I'm calling you, right? Like, hey, Dr. E, I know you don't know me, man, but want to go get dinner and some drinks and just like hang out for a bit? Are you gonna be like, yeah, or are you gonna be like, who is this guy? Like, where's
Exactly. So honestly, when you reach out to like doctors specifically or their offices, I think it's flattering. I think because they say, "Wow, of all the offices, they picked us to reach out to." So usually, I think they're, for the most part, the ones that are not like not arrogant. They're flattered and they're happy that someone actually is interested in their practice and wants to meet them. So you explain to them you're a new office, in the area, and you want to meet them, introduce yourself, and talk a little bit more about your office, and if it's okay just to have lunch. And most of the times they're very open to it, and who doesn't want free lunch or free dinner?
yeah.
So you're not losing anything to meet a new doctor. They perhaps maybe in the market looking for another office to refer to anyway. So it's just a win-win for the most part. And even if they don't refer to you, at least they got to meet you, they had a good lunch or dinner, and then that could just be it. But for the most part, just telling them that you're new and this is the reason you want to meet them, because you're new in the area, you want to introduce yourself, that usually gets them interested.
Yeah. That's good. Awesome. Okay. So then one of the last questions I want to ask you is throughout this process, and let's think about from the moment you decided you're like, I want to do oral surgery to today, right now, right? Like this morning. What's been your biggest struggles or fails or pitfalls?
I would say the biggest struggles or pitfalls, I would say, would be just navigating the business aspect of being an oral surgeon, and then also performing the surgery. So trying to split yourself into two, actually, because as a doctor that owns an office, you're wearing two hats. One, you're a business owner and a manager, and then second, you're also a doctor that needs to be compassionate and skilled, and be able to provide good service and care to your patients. So that the biggest pitfall with that is not knowing what hat you're wearing at what
Mm.
point. So maybe a patient comes in, your front desk says, "Hey, this person doesn't want to pay for surgery," right? As the doctor, you're kind of, maybe taking it personal, like, "Hey, I'm a good doctor. Why don't you want to pay for my procedures?"
Uh-huh.
But as a business person, you ought to say, "Well, you know, maybe this person needs help financing their procedure. Maybe they just need some more information so they can be more aware of how financing works or how the paying for a procedure works." And being a business owner and a doctor, it's hard for you to split yourself into two and wear different hats at different times. So I think that's probably the biggest downfall for me, and probably for any doctor that owns their own solo practice. That can easily lead to the detriment of your business if you don't know how to separate the doctor part from the business owner and the manager part of it.
Man, how do you do it then? How do you like know exactly when to separate?
So it's still a struggle every day. So what I do is I have specific business owner or manager days or hours. So on Wednesdays or when I use for like my actual, I'm a manager on this day. I'm not a doctor here, so I don't
Mhm.
see patients on Wednesdays for that reason. And if it's not a Wednesday, I just focus on patient care. And if staff have any issues or whatever, then I wait until Wednesday to deal with it. So I'm not juggling between an owner, business manager, and a doctor, at the same time. Because you can really get turned around, and it can really, drain your energy and stress you out, and it can then spill over into your actual performance, in your actual procedures that you're performing on patients. So the best thing to do would be to split your time, pick a day that you're gonna be a manager and an owner, and then the other days, which is the bulk of the time, you're actually the doctor treating patients, because that's what you're more productive at doing. That's what brings in more production for you as the doctor when you're doing procedures. If you're just sitting around doing meetings all day, you're not productive. You're not making any production.
Yeah, no, definitely 100%. So on the Wednesday, break it down to
Mm-hmm.
us. Like, what's a manager day? Like, what do you do specifically that day?
So on Wednesdays, I do bookkeeping. So I look at the books to see, to make sure it's balanced. Double check receipts to make sure insurance companies that said they made payments for whatever procedure have actually made payments. You run your accounts receivable reports to make sure that you're in line with where you should be. You're not falling too far behind. Your collection percentage is at least 80 to 90% or more for your insurance claims that are outstanding. You pay bills, so there's a lot of bills to pay. So you make sure you pay your bills on those days, and you run payroll usually. Wednesdays is when I do the payroll. Depending on when it falls, but most of the time it works out well that Wednesday is a good day for it. And you also look at marketing.
Mm.
So you look at, how can I grow the business? Look at how the business is faring from one year to the next. Am I growing? Am I going down? Am I getting more patients from this doctor? Or when was the last time I had a referral from this particular doctor? And then you say, okay, let me increase my, marketing outreach. You may, make some posts online, to engage more with your followers on those Wednesdays. And then also, if you have any calls that you need to schedule or any meetings, you schedule those on the Wednesdays, like lunch with doctors. You do those on the Wednesdays, or if you have a new equipment rep in the area that wants to discuss a new product, you do those on Wednesdays as well.
Man, it almost feels like there's not enough time in Wednesday. You know what I mean? Like,
It's not enough. It spills over sometimes, into different days, but you try to do the bulk of it on a specific day that you pick. If you have a partner or office manager, it's easier. Like for me, I don't have an office manager, so I have to do a lot more than the typical doctor who has a manager. The manager will typically do a lot of the stuff,
yeah.
pay your bills, check your AR, all that stuff. But I, unfortunately, don't have a manager, so I have to do all that myself. But that's usually the easiest way. If you have a good manager, that's the easiest way to do it. But if you don't, then you got to do it. Learn how to do it, because it's your business at the end of the day.
Yeah. Do you ever find yourself, Dr. E, like on that day where it has to like a lot of things, you have to be productive and everything? You're like, oh man, I'm on like Instagram. You know what I mean? Like, or you're making a post and you're like trying to you're doing all these nice things to the post, and you're like, I spent an hour doing that. Has
For
that ever
yeah,
happened?
yeah, it is. I mean, it's a juggling act, because I mean, you need to do it, but you need to be time conscious as well. So some days I'll spend more time than I would like. But so what I do now with posting for social media, I do it first thing in the morning, because I usually have a extra like 15 minutes before like getting ready to leave. So I usually do try to post first thing in the morning. Plus, that's when you get most views anyway. Most people are just starting their day, scroll through their feeds. By the end of the day, they may look again, but the majority of the views that I've seen, they come from the morning to like the early evening. And then after that, you don't really get much more engagement. So I try to post first thing in the morning, so that way I don't waste time on Wednesdays doing any kind of posting. I kind of focus on the business aspect of
Yeah.
managing everything else.
Okay, good. That's good advice. Awesome, Dr. Reed. Thank you so much for being with us. It was a pleasure. But before we say goodbye, can you tell our listeners where they can find you?
Perfect. Yeah. Thank you. Thanks for having me as well, Michael. So I'm very active on Instagram. My handle is at doctor, so Dr. Egolum, Egolum. I'm also on Facebook. Look for Bowie Oral Surgery. You can find us there, as well as on LinkedIn. My first name is Nkemakonam, and then last name Egolum. And you can find a lot of interesting case presentation videos and discussion on all those platforms. And I recently started a YouTube as well, and it's at the Dr. Egolum, Dr. as well.
Awesome. So, guys, that's all going to be in the show notes below. So, check it out. And, Dr. E, thank you so much for being with us. It was a pleasure, and we'll hear from you soon.
Awesome. Thanks, Michael. Nice talking to you.